So the focus of our paper was sex disparities in physical inactivity. And specifically, what we wanted to look at was whether sex disparities in physical activity were uniformly distributed throughout the US population. That is, are women less likely than men to engage in physical activity across all sociodemographic subgroups, or are there subgroups in particular which are most affected by this disparity? My name is Ahmed Sayed from Ain Shams University. I'm currently a medical intern there. And with me is Dr. Salim Virani, who currently serves as Vice Provost for Research at Aga Khan University. And we're honored to be presenting our research on sex disparities in physical activity that's going to be featured in an upcoming issue of the Mayo Clinic Proceedings. So the title of our paper is Factors Associated with Sex Disparities in Physical Activity, an analysis of the Behavioral Risk Factor Surveillance System 2011 to 2021. It will be appearing in the July 2023 issue of the Proceedings. So to tackle this question, we used the Behavioral Risk Factor Surveillance System. This is a nationally representative sample of the US with millions of participants participating over nearly a decade's worth of data. And what our research shows that although women are on average less likely to engage in physical activity than men, there are certain sociodemographic subgroups which seem most affected by this disparity. So specifically what we found was that very young and very old women, as well as women who are Black or Hispanic, women who are poor, and women who are unemployed, these seem to be the subgroups which are most affected by this disparity. An additional troublesome finding of our study was that women with certain medical conditions were also significantly less likely to exercise than their male counterparts. So specifically, women with diabetes, hypertension, obesity, and cardiovascular disease were significantly less likely to utilize exercise compared to women who were not.
So thank you, Dr. Said, for providing overview of the study. I'm going to talk about what are the key takeaways from this. As Dr. Said very clearly laid out, that we know that there have been disparities with women being less likely to be engaged in physical activity compared with males. But what this work shows is that this disparity is exaggerated for young women and very old women compared to those in middle ages, those with low income, those who are Black, those who are less educated, as well as those women who have cardiometabolic disorders like diabetes, hypertension, and cardiovascular disease. So as clinicians, what is extremely important for us is to realize that if we see a Black woman who is young, may have diabetes, and has low income, that person is way less likely compared to a man to actually be doing physical activity. So when we give our prescription for physical activity to our patients, especially women, we have to be very cognizant of these social determinants of health. Just making the recommendation may not be enough, but we have to dig down and understand how is a patient, especially a woman, going to be able to follow that prescription that we've given them for physical activity. Apart from this, another important area is that since we see this disparity at the extreme of ages, this again highlights that we have an opportunity as well to start working on physical activity programs in very young ages, for example, in schools, as well as we see this disparity exaggerated in old ages. So there is an opportunity that perhaps some group-related physical activity programs, as well as physical activity that can be done at home, could be beneficial for older women as well to reduce this disparity. And perhaps it is, as we all would agree, important to increase physical activity levels in both men and women. But we need to be especially mindful of the social determinants of health in women. Last but not the least, when policymakers are making policies to increase physical activity, they need to be mindful of these social determinants of health as well. Well, if we just make parks, but there is no safe neighborhood where men and women can go out and go to those parks, it's not going to work. So we need to be very mindful of these social determinants of health when we are looking at physical activity. We should not be looking at physical activity in isolation. So these are some key takeaways for clinicians as well as policymakers from this work that was led by Dr. Syed. I'm going to throw it back to you, Dr. Syed, so you can say what are the next steps in terms of research for this work?
Yeah, so As we very nicely laid out, now that we know which groups are specifically affected by these sex disparities, the next step, in my opinion, is to start trialing solutions that are aimed at tackling those specific subgroups. So, for example, we have a vast track record of interventions that are targeted at parts of the community which are underprivileged, that have demonstrated success in promoting a variety of medical interventions. And it's about time we do the same for exercise in women, because exercise is medicine. Specifically, what we can do is, for instance, as you highlighted, in young women, can we perhaps enact programs that aim to increase the interest of women in exercise during adolescence, so that we can minimize the size of this disparity during periods of young adulthood where the gap seems really widest? And likewise, can we find ways to maintain the engagement of women during middle age and throughout the elderly time period, so that the decline in physical activity for women is not nearly as sharp as it is now? And likewise, can we perhaps focus on group-based activities, which are especially promising in women, so that, for instance, if you're able to promote a community as exercise intervention in underprivileged groups, could that uplift the community as a whole and promote widespread exercise in those particular communities? I think those things are questions which are amenable to be answered by randomized clinical trials, and I think we have a vast record of previous trials from which to draw upon to tackle these questions.
Thank you, Dr. Said. So this was our work highlighting sex-based disparities, but actually subgroups where these disparities are extremely exaggerated. We hope that you find this paper useful, and we hope that you will read this paper when it's published in Mayo Clinic Proceedings. Thank you for your time.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.